This segment of Delmarva Life is brought to you by Chesapeake Eye Center.
Question for you, has this ever happened to you? You feel that itch in your eye and you just start rubbing it. It still itches, so you rub it again. And then, before you know it, your eye starts to burn, tears well up, you rub it some more, the next thing you know, your eyes are red, maybe swollen, sounds like an eye infection.
Oh, I think we've all been there. It could be conjunctivitis, red eye, or blepharitis, both uncomfortable, both preventable. According to Dr. Tracy Boss at Chesapeake Eye Center, you just need to wash your eyes. You know you're supposed to clean your teeth daily, but what about your eyes?
What you do is you take a Q-tip and you scrub down that lower line.
Dr. Tracy Boss of Chesapeake Eye Center says same rules apply.
If they would do it correctly, they could really prevent a lot of issues with their eyes.
Specifically, the edges of your eyelids where the lashes grow.
So most people are told, the doctor will say, hey, clean your eyes, clean your lids and lashes, and they don't give them any further instruction. And if they don't have that instruction, they don't really know how to do it.
Dr. Boss says it's simple.
So my recommendation for cleaning the eyes properly would be that you take first a warm compress, not hot or scalding, but a warm compress, and you hold it over your eyes for about 5 seconds.
She says the warm compress will loosen up all the oil glands along your eyelashes. There's about 30 to 40 on each lid. That's also where debris, such as makeup, can collect and clog the glands. Next, you make a solution of a half cup of water and 2 drops of baby shampoo.
And you make that mixture in a little cup, and then you're going to dab either a face cloth in there or a Q-tip, and then you're going to pull down your lower eyelid and scrub right along the lid margin, and bring your upper eyelid up and scrub on the lid margin there.
Cleaning the lids keeps the glands free of debris and clear to produce a thin type of oil that keeps our tears from evaporating.
If you don't do that, the oil stays in the gland and it blocks it, and then the oil starts to back up and you get styes on the eyes, you get blepharitis, you get severe dry eye, pain, discomfort.
And if you've ever had a sty, you know it's painful.
On the lower lid, there's between 30 and 40, and on the upper lid, between 40 and 50 glands. So everywhere there's a gland, you can get a sty, just imagine.
Left untreated, a sty can grow.
So a sty comes when the oil gland has been closed or blocked off for some time, and the bacteria gets in that oil gland, and then it starts to produce oil and it can't come out because it's blocked. So then it backs up and backs up, and it backs up to get larger and larger and larger until you see this big bump on your eye.
Dr. Boss says if warm compresses and cleaning the lid doesn't clear the sty, it's time to get medical attention.
You can do the lid scrubs and warm compresses until you get to your doctor, and the next step is we would treat you with an antibiotic drop or ointment and sometimes oral medicine.
Avoiding that trip to the doctor can leave you with even bigger problems.
Sometimes they do go away on their own. Sometimes they don't. It could continue into a condition called cellulitis, which is an inflammation around your whole eye that would cause the eyelid to close. You couldn't open the eye. You'd have pain all around the eye, sometimes a toothache, or just the side of your face would really hurt. And that is much more serious. Scrub right along this margin here.
A serious problem prevented with a simple solution. And of course, the bacteria that builds up on the lids and lashes can also cause pink eye or conjunctivitis in the eyeball. Yeah, that's no fun either.
That's why I had to quit using makeup on my eyelashes. Just stopped. Yeah.